Hey y'all, how y'all doing? So I'm feeling casual today, no suit today, just gonna wear the shirt. Because it's a beautiful day outside. It's kind of unusual for Michigan to be this nice at this time of year. Hope it's beautiful wherever you're all at. This week we're going to be talking about GIS and spatial epidemiology a bit. And so what I want to draw your attention to here first is this map from 1854. John Snow drew this map back in during a cholera outbreak in London. And his idea was to figure out where the cholera outbreak was coming from. And in this case, he made a map and he quickly found out. He looked at all the cases and noticed that the Broad Street pump was right in the center of all these cases of cholera. And outside that, there's no cases. So logic would dictate that it must have something to do with this pump. Cholera has to do with water. Let's go turn the pump off and save the day. So this was the first sort of instance of spatial epidemiology, of using maps and spatial data to inform public health and to inform how we respond to diseases. So why maps? Why do we even do maps? How can maps help to make evidence-based public health decisions? Well, maps help us to explore and analyze data for spatial trends. Many public health outcomes have spatial aspects to them, really most in the end, because a lot of disease has to do with person-to-person contact, and the people who you are proximal to are more likely to either give you disease or you give them disease than people far away. And even in terms of chronic diseases, when we look at that, people who are proximal to one another are more like one another than people who are far away from them. So there's a spatial aspect to that as well. And then with point source exposures, for example, like environmental epidemiology, that, for example, cancers around areas of environmental contamination, we notice, like the Broad Street pump, there's many cases around this particular site, and risk increases the closer you get to it and decreases the further you get away. So, long story short, spatial epidemiology is really everything in epidemiology in a lot of ways. Maps themselves can help us to present information that guides public health efforts. People love maps. They love pictures and they love maps. And for a lot of us here, we look at a map and it's really an effective way to communicate where disease risk is, what are the types of patterns of risk. You can really say a lot with these kinds of pictures. It requires no sort of, in most cases, no sort of statistical training. Anybody can look at these. So great for professionals and also great for lay people and the public. So the first question is, what is GIS? Geographic information systems aid in the collection, maintenance, storage, analysis, output, and distribution of spatial data and information. This is sort of a textbook definition of what GIS is. GIS uses advanced analytical tools to explore at a scientific level the spatial relationships, patterns, and processes of cultural, biological, demographic, economic, geographic, and physical phenomena. So, textbook definition here. You can see that GIS really encompasses everything. People live in spaces. On the internet it's a little bit different, but in terms of our public health, our physical proximity very much matters. And GIS is one way to approach that, not only for public health, but also for other economic and cultural and physical phenomena, just like it says here. So when we look at maps like this, what do we see? We see that there's differences between different areas of town, for example. Here we have another example of maps. This is a railroad network in the United States. But this tells us how transportation infrastructure runs in the U.S. Maps and GIS are also used for different sort of climate and environmental assessments. So for example here, this looks like temperature. This is a temperature map that uses remote sensing data. And then of course for public health. Here is H3N2 virus cases and hog inventory by state to help perhaps explain why there were particular centers of H3N2 back in 2017. And then we can use it for public health planning. So here's distance to nearest health facility in Zambia. A wonderful country. I recommend that everyone go there. Definitely eat the worms. They're good. Fried worms, very famous. But the beef is excellent too. Anyway, so this is a map of distance to nearest health facility. And this can help guide us in figuring out where to target efforts for example, community health workers, people embedded within the community to respond to health concerns and to do basic sort of medical care. And then, there's larger scale sort of GIS and spatial epidemiology. This is a map of malaria in sub-Saharan Africa, I think. It's a good question. What is this a map of? Malaria? HIV? Anyway, public health. There are many ways to do GIS analysis. There's software packages out there. One thing I would like you to not get confused by is GIS is not a software package, it's a methodology. These here are particular software packages that you can do GIS with. ArcGIS is probably the most famous and is used broadly by people in the public sector, principally, not exclusively, but many in the private sector. Carto is another one. QGIS is a free software package that you can download and use, and it's similar to ArcGIS. And then the simplest is Google Maps, which I think you've all used when driving around, for example. Those are all different software packages that you can perform GIS analyses in, and we can do public health work with any of these. I use R and RStudio to do my GIS analyses, just because that's what I feel like I'm good at, or what I'm trained in. R and RStudio are becoming more and more popular amongst epidemiologists in both public and private sector to do spatial analyses or do any kind of statistical analysis. And R is free, so yeah, highly recommend R. I totally preach the religion of R. At its core, GIS is a system that uses spatial data to help people answer specific questions about the world. As we will find, there are many types of data that are used in GIS analyses, but what is common amongst all these data sets is the concept of space. GIS is considered to be a system or a methodology. There are many definitions of what GIS is, but space is key to all of them. GIS is technically comprises 5 components. You can see here in this picture the 5 parts of a GIS: hardware, software, data, people, and methods. Hardware is the computer on which a GIS operates. There are many types of hardware that a GIS can run on. From right now, from dedicated computers in huge facilities to your cell phone. Anything that can process any kind of data of any kind is suitable to run some kind of GIS. Software provides the functions and tools needed to store, analyze, and display geographic information. These can include software tools for the input and manipulation of spatial information. So for example, like your cell phone. You can put in different information and then see maps. Tools that allow or support query analysis and visualization of data. A data management system. A graphical user interface, or GUI, which allows the users to access and use these tools. Data. Well, you can't run a GIS without data. That doesn't make any sense. It's geographic information systems. You have to have information. And so data is key. It's probably the most important part of all this. Data for GIS can be any kind of data, but it has to have or be able to be linked to some kind of information on location or space. So there are sort of 2 different ways of referring to space. You could refer to space explicitly, like for example through latitude, longitude, or XY coordinates. Or you can refer to space implicitly, like through place names, for example. So any data that has some sort of spatial information in it can be used for a GIS. People, most important part of any analysis. If you don't have people to do it, you can't have any analysis. People are needed to manage the system and develop plans for applying it to real-world problems. GIS users represent a wide range of expertise and expertise levels, from people who are developing new methodologies for spatial analysis in public health, down to people on the ground who collect the data. So we're all in this together and we're all part of this. And this is just like sort of any other type of survey or data collection process in public health. There are people on the top, either creating new methodologies or analyzing data. And there are people, all the way, I don't want to say the bottom because it makes them look less, because it's not true. Everyone's just as important as everyone else. The people who are on the street knocking on doors and collecting data with their devices or whatever. Methods. A successful GIS operates according to a well-designed plan and business rules, which are models and operating practices unique to each organization. There are many methods and they vary by organization and application. It says we'll be discussing some of this in the course. Obviously the slide is for another course. But the point here is there are different types of methods. And in public health, we have our own methods. There's different types of applications for things like UPS delivery or FedEx or Amazon or whatever. But we all, are using this process of GIS, and we sort of just all have our own different spin on it. And different sorts of sets of priorities for sure. So why do we use GIS? It allows us to make better decisions. It creates a solid evidence base to make better decisions to do things like deliver public health resources. If we don't know where the people are who need public health resources, then we can't deliver them. And GIS is one place of one way that we can target our resources to the place where they're best needed, most needed. We can maximize our data. We can explore all aspects of the data we're collecting. So it's one thing to go in and do a prevalence survey, for example. It's another thing to go in and do a prevalence survey and ask, where the different areas of prevalence are. How do different regions compare with others? And we can make maps. People love maps. People are so excited about maps. You show them a map in a presentation and people just get so excited. And that's really cool because it allows you to provide a lot of information in a short time. Share information with non-specialists. People who are not public health people, they also get excited about maps and they want to know. You can inform policymakers, politicians, and the general public. And my experience is that politicians generally do not have training in things like public health. And they tend to give you very little time, and you want to maximize how you use that time and the efficiency of your messaging to them to get the point across. So definitely, GIS is great for policymakers and getting your message across to the public and to the people who are going to make stuff happen. What can we do with health GIS or spatial epidemiology? A Department of Health can determine the best location for implementing intervention. Just as we said, we can target public health resources. A county West Nile surveillance program, for example, can spot disease clusters and rapidly respond. With COVID-19 is one thing where we can spot where clusters are happening and go out and respond to them, send contact tracers, which I think a couple of you might be involved in, from what I've heard. Another example is an NGO, non-governmental organization, can determine which subdistricts have the highest levels of malnutrition, as an example, and can then maximize the impact of a program. And a primary health center can target villages with most limited access to services. So I was involved in a project in Malawi several years ago on the distribution of insecticide-treated bed nets. And one thing we found was that households that are far away from health facilities tended to not only were they less likely to have a bed net, they were actually less likely to use them. So we found out two things. First, that we need to go directly to villages to deliver things like nets. And second, we have to go to villages to deliver public health messages on why using bed nets is important. We found that out through GIS and spatial data. So that's